Hello, welcome friends. Once again, this is Dr. Hitesh Shah on Lybrate, looking after your sexual health, emotional health and relationship health. Friends, our today's topic is narrow introitus or small vaginal opening and how it affects the first sexual intercourse. Well friends, as you are aware, every virgin girl who gets married and will have a small vaginal opening, relatively smaller vaginal opening, and will have initial difficulties for penetrative intercourse. But generally through a little forceful penetrative attempt, it happens. There can be bleeding, there can be pain, but then she overcomes it gradually. But it's a spectrum. So some women have very narrow opening, very small opening. It's even difficult for them to insert even one single finger, forget two fingers. An erect penis is generally more than 4 fingers thick. So it is difficult for an erect penis to enter. That leads to pain. That pain leads to again fear. And often narrow opening is associated with penetration phobia or even vaginismus. So things get little more complicated for those women. Similar situation exists in men. They have a very narrow foreskin, which is called phimosis. So coming back to women, now this problem when it exists, it's difficult for them to have a penetrative sex. Often they undergo surgery also to open up their introitus and remove the hymen. But there is a limitation to surgery because you can't make the opening so big, and because there is a urethra above, there is a perineum and anal canal below. So beyond a point, it cannot be opened up. And if the elasticity is not developed, even after surgery, we get many cases where penetration does not happen. Even if there is no fear, no vaginismus, but just penetration cannot happen. Now, when we encounter with such cases where couple cannot have first intercourse, because even if the husband has a good erection, proper positioning is there, but they can't insert at the right spot because the opening is relatively small and the elasticity has not developed, we help them non-surgically. There are homeopathy remedies which help to develop elasticity, and there are certain techniques which we guide couple through, and they are able to develop that elasticity, and very smoothly they come out of this problem. In fact, we have many unconsummated cases, 1 year, 3 years, 5 years, 10 years, 15 years of marriage who could not consummate because of this kind of problem. And once they undergo right kind of guidance, techniques and treatment, they are able to consummate, in fact, practically without any pain. We also get such situation of narrow introitus even post delivery. Post delivery, there is sometimes suture is taken after that episiotomy cut. If the suture is overtaken, it can narrow the natural opening. So in that case, when the woman comes to us, again there is a treatment, and without surgery we can help these women. This problem also can happen in the later stage, post-menopause, when there is a very low level of estrogen, lot of dryness in the vagina and constriction happening, and woman finds this very painful and difficult. Again, homeopathy helps, non-surgical techniques helps. So friends, there is a treatment, there is a cure. You need not stay with your pain and fear, and you can have your marital harmony. Thank you so much. You are always welcome for any query, any solution on Lybrate. This is Dr. Hitesh Shah in Mumbai and online. Thank you.